Good evening, students. Welcome back to our channel Ach'z. So today we had our OET exam, 8 March 2025. So in today's video, we are going to discuss about the complete review, or we can see it as the question paper discussion. So we collected question papers from different time zone and we are going to discuss about that in today's video. So as I mentioned always, if you got any other question category, means try to mention that below and mention your test center also, at least the country. Okay, so it will help other students also to just cross check with their experience, or those who are planning for the upcoming exam, they can just use that for their preparation purpose. So now we will discuss first about the reading module as usual. In that, the first set, the part A was about rosacea, and in that the test A including definition and types, test B symptoms and signs, about the facial redness, swelling, superficial dilated blood vessels and all. Then about test C, about the risk factors and diagnostic factors. And the last test D, about medication and the treatment. They specify clearly about the antibiotic therapy. And in that, the C1 and C2 including patient confidentiality and informed consent. Coming towards the second set of reading, part A including Stevens and Johnson syndrome. And in that, the test A including definition and other names like toxic epidermal necrolysis, TEN. Then test B including causes and risk factors, test C about the symptoms and signs, and the test D about treatment and medications. I hope you are clear with that. And in that, C1 and C2 including infection control and hospital management updates. And the third set of reading, part A was about floating harbor syndrome, and in that the test A including definition and description, test B about the signs and symptoms, test C diagnosis and causes, and test D about the management. And in that, the C1 and C2 including handling of rare medical cases and ethical dilemmas. So that's about the reading module which we collected from students. I hope you clear about the three different set of questions booklet. Now we will move towards the second module, writing. In that, the first set of letter, it was a referral letter. And the scenario, a 6-year-old child has been experiencing frequent asthma attack, and especially at night despite using a prescribed inhaler. His mother reported difficulty in controlling the symptoms, and there have been multiple emergency visits in the past 3 months. So your task is to write a referral letter to a pediatric respiratory specialist requesting an evaluation and possible adjustment of the treatment plan. So you need to include the details about the child's current medication, recent episodes, and any potential triggers. So that's about the first set of letter. It was a referral letter. Coming towards the second set, it was a discharge letter, and the scenario, a 45-year-old patient underwent a laparoscopic cholecystectomy, which means the gallbladder removal due to the gallstones. So the surgery was successful and the patient is recovering well without any complication. So your task is to write a letter, which means the discharge summary, to the patient GP and to summarize the surgery, post-operative progress, pain management plans, then the dietary restriction, and about the follow-up care recommendations. So that's about the second set of letter. Coming towards the third set of letter, again referral letter, and the scenario, a 63-year-old patient who suffered a stroke is now struggling with aphasia, difficulty speaking and understanding the language. The patient can follow basic commands but has trouble forming sentences. So your task is to write a referral letter to a speech therapist outlining the patient's difficulties, progress in the hospital, and also the recommendation for the speech therapy sections. So that's about the three different set of letter question booklet. And now we will move towards the next module, speaking section. And the role play cards available. The first one, the setting was an emergency ward. Talk with patient daughter. Patient suffer from cirrhosis of liver. He has been a drinker for a long time. Doctor is concerned about her father. So want to restrain from this drinking habit. So you need to answer to all the queries, educate about father's condition, talk possible treatment modes, and provide suggestions to get over of this alcohol addiction. Now coming towards the second role play card, the setting general ward. The patient 45-year-old recovering from abdominal surgery. So you need to explain about this post-operative care, advise on the pain management, and reassure about this wound healing, the techniques and all. Coming towards the third role play card, setting a surgical ward. The patient admitted with incompletely healed surgical wound was posted for incisional hernia repair a year ago. So patient is anxious and worried. So you need to collect the history of this previous surgery and also the other medical condition. So explain regarding the reason for this incisional hernia and about not healing the wound, and reassure him that it is curable. So that's about the third one. Now coming towards the fourth set of role play card. The setting is emergency department, 60-year-old experiencing chest pain. So you need to ask about the symptoms and the medical history, explain possible causes, and advise on immediate test and procedures. Now the fifth role play card, the setting is pediatric ward. So the parent of a 3-year-old with a fever. So you need to reassure the parent and explain the fever management at home and advise on when to return to the hospital. And the last role play card, the sixth one, the setting is surgical ward. The patient admitted for septoplasty. So worried about the surgery. So you need to explain about the procedure, reinforce the patient about the possible mild nasal and sinus pressure, and also the pain for the first few days after the surgery. So you need to mention about the recovery period and what all things the patient want to take care about, and persuade the patient that he will be under sedation followed by the incision and the correction of the septum. So that's about the last role play card. Now we will discuss about the last module, listening. In that, the first set, the part A with talk by a pulmonologist to a patient with asthma. And the part B includes the talk by healthcare professionals about the shift change updates. And the last part, healthcare presentation, it was about the AI in medicine. And in the second set, in that, the part A including talk by orthopedist to patient with fracture. Then part B, workplace communication about this medication guiding. And the part C, healthcare presentation about the patient confidentiality. Coming towards the last set, the part A includes the talk by cardiologist to patient on the stroke recovery. And the part B, short talk about this hospital policy changes, especially about the infection control. And the part C was about the vaccination program. It was a presentation. So that's about the three different set of question booklets which we collected under listening, reading, writing and speaking. I hope you all attended well, and as I mentioned before, you can also comment your experiences below, and if you got any other question booklet, means try to mention regarding that too. It's always better to make a comment over your experience, how you felt about each and every module or the skill assessment. So it will help other students also to get ready for their test. So I hope again you will get good band score as per your requirement. God bless you all, and do watch this page to get all the OET related updates. Thank you so much for your time over here. And if you need any material, especially the reading mock test specifically for anything which we mentioned today, means you can just comment over that. Definitely we will publish the mock test for that particular topic. So again, do subscribe and watch on this page, and God bless you all. Thank you.